Hey, how you doing, everyone? So this video is going to be about pelvic inflammatory disease, and hopefully we're going to do it in less than 5 minutes. So the aim of the video is not to explain everything in a lot of detail, not to explain like the pathogenesis or the symptoms in a lot of detail, but what I want to do is make sense out of PID so that when you do go study it, everything just makes logical sense. You're not memorizing random facts, which is really important when studying medicine. So let's get straight into it. Okay, so the first thing to understand about PID is it's not one disease. So stop thinking of PID as a separate disease. But what you should think of it as, a progression of diseases along the anatomy of the female genital system. So it could start off from the vagina or cervix, and depending on the person and depending on the severity, it can ascend into the uterus, and then it can ascend into the fallopian tubes and to the ovaries as well. So it's actually a spectrum of diseases. It's not one single disease, but it's a spectrum, and it involves cervicitis, salpingo-urethritis and endometritis, tubular ovarian abscess, and chronic scarring. So you can actually, when you read in the books, they'll mention these things. And cervicitis and endometritis and salpingo-urethritis, these are acute conditions, whereas tubular ovarian abscess and chronic scarring, they're more chronic, so they occur later on in time, and it will make sense why. So let's just get this out of the way. So normally PID, or these conditions here, are caused by chlamydia or Neisseria gonorrhea, so STDs basically. So they cause this. Other things can cause it, but these are most commonly the reason for it. And the progression of PID, so the progression of cervicitis, salpingo-urethritis, tubular ovarian abscess, and chronic scarring, and its progression along the genital system, it really depends on two things. Number one is that is the patient being treated, and number two, how's their immune system? Is their immune system working? Is it functional, or are they immunocompromised? Okay, so let's take a look at this flowchart, and hopefully things will make a lot more sense, and then you can go on and study the pathogenesis and the symptoms in a lot more detail by yourself. So let's keep in mind the anatomy here. So normally Neisseria gonorrhea or chlamydia, it will first infect the vagina, or it can affect the cervix, and it can cause inflammation and all those symptoms like the purulent discharge and whatnot. And then normally what happens is that during menses, it will ascend into the uterus and possibly the fallopian tubes, and it can cause endometritis, it can cause salpingitis, and it can also go into the ovaries as well, and it can cause urethritis as well. So this is a progression, so it progresses. So this is basically the infection progressing along the anatomy. And now this is where it gets important. So if the patient is not treated for cervicitis or salpingo-urethritis, then what happens is that it takes the condition, it creates a PID that's acute, and it turns it into a chronic case. Oops. So the chronic cases are here. Tuber-ovarian abscess or chronic scarring. These are the conditions that are chronic in PID. Now, which one it develops into will depend on the patient's immune system. So if the patient has a working immune system, so his white blood cells are strong and they're able to fight off the infection, then what will happen is that you'll get chronic scarring. Because remember that chronic inflammation can lead to scarring because there'll be a lot of damage to the tissue around it, so there'll be a lot of fibrosis. So it makes sense that you get chronic scarring of the anatomy. So normally you get chronic scarring of the fallopian tube and possibly even the ovaries as well. And logically, this can therefore lead to a risk of ectopic pregnancy or infertility. Now, on the other hand, if the patient is immunocompromised, in other words, his body is not able to fight off the infection, so the infection is able to continue to spread and to proliferate and to really act freely, it will eventually turn into an abscess. And this is a very severe case, and it can cause obviously an abscess, fever, abdominal pain, and it can be very, very severe. So without prolonging the video too long, PID is essentially a progression of an infection that's caused by chlamydia or Neisseria gonorrhea. And the two things that you should always keep in mind is the patient treated? If the patient's treated, it won't go further than salpingo-nephritis or endometritis because we're not giving the infection a chance. But if it's not treated, then it can become chronic. And if it becomes chronic, it will either become a tuber-ovarian abscess if the patient's immune system is not working, or it will turn into chronic scarring of the anatomy if the patient's immune system is working. So thanks for watching. I hope a light bulb went off there. It certainly did for me when I figured this out. So please do like and subscribe if you found this useful. Thanks a lot.